The conference really comes at a very exciting moment when access to proton therapy is going to vastly increase in the UK. If this had been 10 years ago, the funding would have been much easier, but it is going to have to win support and win referrals in a very much tougher environment than was the case 10 years ago. And one reason is that there are other pressures on funding from education, the effects of Brexit and so on, as well as in the health service. But also there is more concern about the funding pressures in specialist commissioning, which covers 150 different services, and where the spend is now 15 billion, rising to 19 billion over the next 5 or 6 years, which is more than the national spend on primary care for 60 million people. So proton therapy is going to have to get funding and get support in a very difficult environment, but much of this conference has shown that there are positive ways of doing that. I argue that show that proton therapy must first of all show how it can lead to a care pathway in which proton therapy leads to much better quality of life over a long period of time and much greater opportunities for individuals because of they don't lose cognitive ability and they don't have serious problems with continence in the case of prostate cancer. It can't just be a one-off episode of treatment. It's got to be a lifetime investment. And the evidence from Florida and elsewhere, which was given us earlier, shows that it's possible that adult patients can also benefit greatly from proton therapy as well as child patients. The second thing that proton therapy has to do is to show that it can deliver at a lower cost than the 100,000 per patient, which has been the cost of sending kids abroad in the past, and that it also can improve the patient experience, because for children who've been abroad, the parents and carers have to be away for 8 or 10 weeks, and although their travel costs may be reimbursed, they're losing work time and also getting quite a lot of incidental costs. And maybe they have to pay for support of other children who were left at home as well. So we've got to improve the patient experience and try to make the treatment shorter, involving less travel time, because even with 2 centres in Manchester and London, there could be quite a lot of travel time. There's a lot of space in between Manchester and London where people live, and people are going to go to those centres and have a patient-friendly experience for this lifetime investment. There's been a lot of concern about the Cancer Drug Fund, because only about 9% of the patients who got drugs under the fund had any information on outcomes, and there may have been less good results in outcomes and more side effects than perhaps were realized. The proton therapy community has got to get together to establish a database so that they can track across all centres for specific groups of patients what the outcomes have been. And this has been done in Florida and is producing some very useful results, showing, for example, that proton therapy can produce more positive results for patients with medium or high-risk prostate cancer than other types of therapy. So they've got to set an example, or the proton therapy centres have to set an example in producing a UK-wide database covering the private and public sector on the gains and results from proton therapy. This is a new start. We haven't had proton therapy, intensive proton therapy before, so there's a chance to jump or establish a good reputation for the kind of metrics which are becoming essential for any program that wants to compete for public funding nowadays. Clearly, the gains to children are great from proton therapy with certain kinds of tumours, and at present only 200, less than 200, are actually getting the treatment when it could be as high as 1,500. So I hope we can accelerate access to the treatment, and that there will be collaboration between public and private sectors, so that if the private sector facilities start earlier, then we'll begin to get experience by sending NHS patients to those centres. And the sooner the metrics start and the sooner the brainstorming about cost reduction starts, the better, because the next 5 years are going to be a very tough period for public spending. We already have a large debt, and there's some signs of it getting larger. The tax revenues are going to be at higher risk with Brexit, even if there are longer term gains which may materialise. And also we are running out of younger taxpayers, and a lot of health funding goes to people who enjoy public services. I'm one of them, but don't actually. I'm not in that case, but don't actually pay very much tax. And proton therapy may help people's the cognitive abilities of young kids, so they can grow up to be more effective in work and develop their careers more strongly, which would be a good thing in itself, quite apart from their tax-paying abilities.